Working as a clinical physician, you are just examining a patient and he presented to you with complaints of a chronic vision loss in one or even in bilateral vision loss can occur in a patient, or it can be a unilateral vision loss that is being experienced by the patient. So, what is the typical history or the questions that you're going to focus on when you're taking a history from such a person who presented to you with the complaints of a chronic vision loss? First of all, starting from the patient's particulars, it can be the age, the gender of the person, the occupation. These are the particular characteristics or the typical questions that you're going to put forward to that person. And then moving on, you're going to focus on the presenting complaints. So when you ask that person to give you a history regarding the vision loss, he or she would focus on the fact that it is a gradual kind of a vision loss that he's experiencing. It happened over a period of time. It was not of an acute intensity. And then you're going to focus on this fact that due to this acute intensity, the vision loss, again, if you look at or if you calculate or clinically examine this patient, you're going to focus on this fact that whether it is a peripheral kind of a vision loss or a central kind of a vision loss that is being experienced by the person. So this is again one of the major differentiating feature when you have these patients of a chronic vision loss. Then once you're done with the presenting complaints, you're going to move forward to the past history. That would obviously include the medical and the surgical history. So the medical history, that what kind of drugs that the patient has been taking, the pharmaceutical managements that he's been carrying on, that is again the main focus over here. The systemic diseases that the person can suffer from, for example, diabetes mellitus, is again one of the major factors for the development of the cataract in a person, and even it can be the diabetic retinopathy that is the cause of a chronic vision loss in a person. So diabetes is one of the factors that plays a very major role, so it should be ruled out at this instance when you ask the patient for any past medical history. Surgical history for any previous eye surgeries or any trauma that has been occurring to the eye, or any infections or inflammations that the person is suffering from. So these are the particular questions that you have to put forward. Moving on, you can ask the person of the socioeconomic history, and all of these that would basically conclude a complete detailed history of the person. Even on the basis of a good history, you can diagnose whether the person is suffering from glaucoma, cataract, or macular degenerative changes, and that is the cause, or that is the definitive diagnosis in this particular patient. So the management would basically start off right from the history taking. When you have this patient of macular degeneration, the patient would not be labeled with macular degeneration. You have to diagnose or you have to get to a conclusion when you have a patient of a chronic vision loss. So this is quite interesting when you have to focus just on the history and you have to conclude what is the causative factor or what is the cause behind this chronic vision loss. So first of all, you're going to jot down a differential diagnosis and then you're going to focus on your questions even when you're taking a complete history. And then you're going to move on to the clinical examination in this patient. When you're going to examine a patient of cataract, obviously the opacity of the lens is going to be looked for. The red reflex, if it is absent, it is going to indicate that the cataract formation is taking place. It can be a mature, a hypermature, or Morganian cataract. You have to look for the features of the cataract in that patient then. Then if you have a patient of glaucoma, obviously the intraocular pressure would be raised in this instance. And then in cases of macular degeneration, you're going to focus on the ophthalmoscopy particularly. You have to look at the macula. You have to look at the type of the macular changes that are occurring in this particular person. Are these any atrophic changes, or are these of the exudative or the liquefactive or the bleeding form that can be seen? Is there any Drusen formation in the patient on the retina? All of these would give you particular evidence towards the macular degenerative changes, age-related macular degenerative changes, abbreviated as AMD in the patient, and that can be documented very easily if you find all of these changes on ophthalmoscopy or on retinoscopy. So this is the mainstay where the management starts off or kicks off when you start off with a detailed history, goes on to the clinical examination of the patient. So over here in this very second section, we'll be focusing on the Amsler grid charting of the person. When you have clinically examined the patient on the slit lamp, you're going to perform some advanced testing phenomena for the diagnosis of the macular degeneration. One of a very important test is the Amsler grid charting, because that would basically signify whether it is a peripheral kind of a vision loss or a visual field defect in a person, or it is a central visual field defect in the person that is being observed. So the referral forms are again very important, because working as a clinical physician, you should know how to write a detailed and a very comprehensive referral form for the ophthalmologist. Because when you just look at your referral form, if it is comprehensive and if it is brief enough, he would know, or he or she would know, that it's basically a case of a macular degeneration and you have basically performed the initial testing on the patient. So the treatment would also be discussed over here. What are the major drugs that we can use in a patient of macular degenerative changes, and then the surgeries? Again, there are sometimes the mainstay lasers can be performed. So all of these treatments would be discussed along with the macular degenerative management, but obviously we have to focus on this fact that the prevention is the most effective way rather than the treatment over here, because prevention is basically going to end up in the more better results in the patients rather than the treatments in these cases of macular degeneration, because these treatments don't have very good prognosis, and they don't have a very good outcome in the patients of macular degeneration. So a lot of tests have been designed to test out the near vision, and one of it is the near testing chart. These are basically the different fonts that are given to the patient for the reading. It starts off with a much higher font or a much bigger font, and then it goes on to a much smaller font, and the person is basically asked to read out these charts, and then you're going to examine, then you're going to basically distinguish whether he or she is suffering from the near as well as the distant vision loss or not. Patients with macular degeneration, basically they have the visual field defects that are located centrally. And basically one should know how to distinguish a blind spot, which is quite physiological, from the central visual field defect over here. So these are different charts for the testing the visual acuity in a person. First of all, you have to have the distant visual acuity being tested, and then the near charting for the person as well. Then we have the Amsler grid recording charts. Again, it's basically a normal grid chart, and sometimes it is performed manually. And then we have the automated methods involving the Humphreys method for the visual field defects that are being observed in the patients. Usually the visual field defect would lie most centrally over here, somewhere over here. When you record the visual field defect, you have to basically draw that visual field defect on this Amsler grid chart, and just to have a view whether it is a peripheral visual field defect or whether it is a central visual field defect that is seen in this person. So the macular degeneration, you can see over here, these are some of the angiographies that are being performed. And over here, you can see the macula. This is the optic disc. This is the fovea centralis over here. And over here, you can see some of the exudative changes. This is a normal macula. Over here, you can see that these are some of the exudative changes. Again, these are the exudative changes. These are the Drusen formations that are being observed on this technique. So sometimes all of these advanced investigation techniques are being used or devised just to diagnose the case more accurately, whether the person is suffering from the macular degeneration or it is of an atrophic kind, or either it is of the exudative or the liquefactive kind in a person. Prevention is one of the factor over here that we have to focus on rather than the treatment. The management basically starts off with the prevention or the further advancement of the disease rather than the treatment guidelines, because a lot of drugs has been devised to treat the patients, but sometimes they don't have a very good prognosis in this case. The treatments, there are a range of treatments that are available for this age-related macular degeneration, but again, as I'm already focusing on this fact that prevention is much better. That can basically range from the lifestyle modifications, the systemic evaluations. If the person is suffering from diabetes mellitus or any other systemic illnesses that can correlate or that can associate with the macular degeneration, they have to be ruled out, and they have to be controlled, because that is going to affect the macular degeneration more effectively. So this is the mainstay. If you want to have a good prognosis in a patient, the management would start off with the prevention rather than the treatment of the disease itself. Over here, you can see the different types or even the different stages of the acute macular degeneration or the age-related macular degeneration. You can see there is an advanced AMD over here. Look at this macula, it's completely deteriorated. There is no complete shape for this macula. It fulfills the guidelines to the form. The deciform scar, this is the deciform scar that is observed in the patients of the advanced AMD. It doesn't have a particular shape. And the subretinal fibrosis and the pigment changes at the macula, and this shows an advanced form of the age-related macular degeneration. If you focus on this deciform scar, it is a more closer view, and you can see that the fibrosis is taking place, the pigmental changes are taking place in this advanced stages of the acute macular degeneration at macula. Even the visual loss can be of the hand movement, or it can be the finger counting. So it can be reduced to these levels, and sometimes if left untreated, it can cause a complete vision loss in a person or complete blindness in a person. Then we have the Drusen formation. These are some of the pigmentations that starts occurring after the acute macular degenerations, and the multiple drusen and the pigment changes can be observed over here. It is one of the guidelines when we are basically diagnosing a person to be suffering from age-related macular degeneration in any case. Then we have the wet form of the age-related macular degeneration over here. In this, you can see that we have the subretinal hemorrhages and the subretinal fluid. It suggests the choroidal neovascularization. Neovascularization is basically the proliferative changes or the formation of the new vessels, blood vessels, that is taking place at the retina. So again, the patient requires urgent referral and assessment over here. So the diagnosis is again very important. If it's a wet variety of AMD, then you have to urgently refer the patient to an ophthalmologist for further management because that is going to be deteriorated very seriously. So again, as I've already focused on, it's again a chronic kind of a disease, but prevention is much better than the treatment prognosis over here when we are dealing with these age-related macular degenerations. The referral forms that we usually give as a GP or a general practitioner, you have to write the name of the consultant, the hospital details on the referral forms. The patient particulars are again very important because the age of the patient is going to point out towards this age-related macular degeneration. And then we have the general physician's name, the general physician surgery's name, the optometrist details that would include the name, GOC number, and all the relevant details of the optometrist as well. If the ophthalmologist want to refer or call that person up personally, it can be quite effective. Then we have the affected eye, then the past history in the either eyes, previous AMDs, myopias, and any other significant finding of a patient. If the doctor finds any other significant finding, he can basically document over here. In the right and the left, you have two basically separate columns for both eyes. The referral guidelines presenting complaints in the affected eye, visual loss would basically the duration of the vision loss, whether it is an acute kind of a vision loss or a chronic kind of a vision loss, that has to be specified or mentioned over here in this referral form. The treatment would obviously depend upon the variety of the macular degenerative changes that we're dealing with, whether it is a dry kind of a macular degenerative changes, a normal eye, a healthy macula can be observed over here, and then we have the wet variety. The dry macular degenerations without bleeding can be observed over here with the Drusen formations, that is the pigmental changes that are taking place around the macula or on the macula, and then the macular degenerative changes that are taking place, and they're basically clinically being examined over here, that there is some sort of a bleeding over here that can be examined, or that can be stayed over here. The early referral in days is very important. Intravitreal injections for those eligible, and how many injections, it's quite debatable. Long-term follow-up, how much long this follow-up can take place, it doesn't have any specific indications for that. And the counseling, the support, and the complete vision loss, other pathologies have to be ruled out in this particular patient. So the treatment, the drugs that are being used these days are the ranibizumab, and then we have the alfibiracept. So these are some of the drugs. Then we have the photodynamic or some sort of a laser therapies with verteporfin, that is basically pharmaceutically known as Visudyne. Subtypes are being used, and then we have the bevacizumab, that is basically Avastin. The active ingredient over here is Avastin, and the subtypes are also being used for the treatment of macular degeneration. Over here, this basically picture is showing you that there is macular degeneration over here, but with no Drusen formation. And over here, you can see Drusen formation. So we have different varieties of acute macular degeneration involving Drusen formation. Then we have no involvement of Drusen formation. We have the pigmental changes on one hand, and on the other hand, it can be a simple wet kind or wet variety of the acute macular degeneration. The prevention is again that we have to focus on when we are dealing with these patients of acute macular degeneration. The treatment would include surgeries and radiotherapies as well. In this case of acute macular degeneration. So the prevention would basically focus on the fact if the person is suffering from some sort of systemic illnesses, for example, diabetes mellitus, that has to be ruled out over here. And then the lifestyle and the environmental changes, they can also prove to be helpful in the progression, in slowing down the progression of the acute macular degeneration, or completely healing this acute macular degeneration as well. And then we have the other miscellaneous preventive measures that can be used for the blockage of the progression of this acute macular degeneration in a patient. So these are some of the management guidelines that we have to keep in mind in cases of a chronic vision loss diagnosed with acute macular degenerative changes. So in this section, basically, we gave you an overview regarding the management of the patients with acute macular degeneration, which is one of the leading cause of chronic vision loss unilaterally or bilaterally in a patient. So that is the end of this section. Thank you for watching sqadia.com.